Hello, everyone. My name is Darlington. I'm the founder of Mino Health AI Labs, headquarters in Ghana. So, today I'll be talking about AI in healthcare in Africa, potential, but also some challenges as well, and then our project. So, what are some of the issues in African healthcare? In 2019, we recorded about 19 million deaths, and out of that, about 56% of it, so about 5 million, came from uh, communicable diseases like lower respiratory tract infections, HIV and AIDS, diarrheal diseases, and tuberculosis, as well as malaria. But also 33% of that death came from non-infectious or non-communicable diseases like stroke, and then ischemic heart disease. Now, a lot of clinical decisions depend on being able to accurately diagnose some condition. And so about 50 to 70% of clinical decisions depend on this. However, the challenge has been that with the current approach, we've had a lot of issues with misdiagnosis and then misdiagnosis. So misdiagnosis being uh, things that were present but were not discovered, so they were missed entirely. And then so from a study, it was discovered that 1% of South Africans were reported to have sickle cell anemia. But then later on, another study, the study discovered that the actual number of people that had sickle cell anemia in South Africa were more than 300% of that original number. So a lot of people had sickle cell anemia, but were not diagnosed to have sickle cell anemia. The other thing is misdiagnosis. So that is when you inaccurately conclude that someone has a condition when they might not have that condition. They might have another condition entirely. Um, so some study from some years ago also discovered that in Kumasi in Ghana, children, about 40% of children who were diagnosed of having malaria actually had bacterial sepsis instead of malaria. And then generally, we have issues around the balance and ratio. So Ghana, for example, has about 10,000 to 11,000 patients per one doctor ratio. Malawi has some of the worst numbers in that as far as Africa is concerned. So 60,000 patients for every one doctor. Now, if you go into specifically radiology, where you're looking at medical images to make decision, South Africa has just 1.2 radiologists for every 100,000 people. So, and Ghana has just one radiologist for every 800,000 people, with a total of less than 40 radiologists in Ghana. So this obviously presents opportunity for AI because AI can help us automate diagnostics. It can help us automate a lot of radiology as far as being able to look at medical images and then make conclusions from it. And so this has led to a number of solutions being developed across Africa addressing healthcare issues. However, some of the challenges that this solution face have to do with availability of data. Having the right amount of digitized medical data is a challenge. So uh, you have modern facilities that have data to help, but then there's so much more that could and should be done. And then the readiness of stakeholders is also one of the hurdles that these solutions have to deal with. So you would realize that a lot of facilities do not have certain infrastructure to accommodate some of this AI solution. But then, yes, so gradually we've been working towards addressing some of this. But also there's a need for the right kind of regulations and policies. Now, the key thing we've been working on with Mino Health is combining AI, data science, cloud computing, and other related technologies to solve a number of problems in healthcare. So more specifically, what that means is that we are developing AI solution towards diagnostics, forecast, prognostics, and also triage. So we have also broadly been doing research that is looking at applying AI to biomedical science, biotech, neuroscience, epidemiology, oncology, optometry. And then a number of things that we've done along these lines is we have an ongoing research with West African Center for Cell Biology of Infectious Pathogens. And what we've been doing is that we're using AI to better understand and differentiate between people who have high immunity towards malaria and those who have lower immunity towards malaria, and what is truly biologically responsible for that difference. And so this will help us better understand immunity and then potentially develop more effective vaccines that can help in developing immunity. We also won UKRI grants in partnership with Imperial College to work on digital diagnostics for infectious diseases like malaria. So the project also revolves around molecular diagnostics and how AI can be used with it towards addressing a lot of infectious diseases, as we currently can see with COVID-19, but also the very stubborn kind we've dealt with for a very long time on the continent, which is malaria. We've had quite some successes with the ongoing grants we are implementing. We've had our work being featured internationally in conferences like NeurIPS, also in the scientific book Advances in Information and Computing. We've participated regularly in MIT's Bio Summits and as part of their biotech initiative, and also been featured in Future of Communication conference. We are also working as part of United Nations ITU, so International Telecommunication Union, and then the World Health Organization's focus group on AI for health. So Mino Health, with a number of institutions across the world, are working on developing standards and regulations to guide the development, testing, and use of AI solutions in radiology and related sectors. I am very much honored that I'm actually the lead of the topic group on AI for radiology under this ITU and then World Health Organization effort. So I manage a team of people across about 4 or 5 different continents, a number of institutions and stakeholders. I mean, yeah, so with most of the solutions we've been developing, we focus a lot on computer vision. So we look at medical images and we develop convolutional neural networks that are able to automatically detect problems within these images, or be able to do other things that might be of interest to us, but primarily looking at medical images. So we've covered conditions like breast cancer, diabetes, pneumonia, fibrosis, hernia, on and on. We actually currently are running a challenge in partnership with Zindi Africa along the lines of being able to detect tuberculosis from chest x-rays. So this is currently running and will end in about a week or so from now. So this is generally showing you what our system looks like. So yes, so that basically covers what I would like to talk about. So telling you the potential of AI in Africa, the issues that exist in healthcare, and then some of the hurdles that AI solutions in African health are facing, and then what we've been working on as part of Mino Health. Thank you for your time.